Hello, counselor. Dr. Kyle here. Let's talk TBI. It is the big buzz on injury awards, and rightfully so, as it can be life-changing for a client. Low-impact auto accidents can result in TBI injury for sure, but I wonder if you're aware that the upper cervical spine injury increases the symptoms and is often the underlying cause of the worst symptoms of TBI, but can be missed by doctors not trained in pairing these together. The truth is, you can have cervical injury without TBI, but you can rarely have TBI without cervical injury. So let's take a deeper dive into this topic to assure that you're not missing this vital, significant diagnosis that could be leading to lower injury awards and shortchanging your client from medical care and compensation that is fair and just if it's not there. Let's first highlight what the cervical trauma and soft tissue injury is that leads the majority of the TBI symptoms, and then add in TBI that, by the way, can happen with low-impact auto injuries. For perspective, when we talk about low-impact auto collision, it doesn't take much. Even an 8-mile-an-hour collision carries with it the 13 G's of force on impact. That's like taking a 10-pound weight and instantly inflating it to over 135 pounds faster than the blink of an eye. Now, balance that on top of a cervical spine, and you can see how CAD injuries don't need a whole lot of speed to be very significant. Remember, the human body was not designed to withstand the forces of an auto accident or sport injuries with high velocity energy into the body at speeds in milliseconds. This is why clients are injured, and what seems like a fender bender is quite significant, and it matters a lot. In this short video, we're going to focus on two insights. One, the symptoms of TBI alone, diagnostics and future care. And two, symptoms of TBI with cervical instability, diagnosis and future care. A study by the Sequoia Group found that 50% of auto claims involve TBI. We know that TBI is significant value-driving diagnosis in itself, so let's first tackle that. Traumatic brain injury has a ring to it that says, pay up. Cervical instability doesn't have the same panache, but like the quiet genius in the back of a class that builds the next internet mega business, it holds immense power. So what does the client triage look like for TBI? The triage is the client is referred for evaluation and may include a questionnaire, neurological testing, behavioral testing to establish the TBI. The symptoms often include cognitive-related problems like memory loss, head fog, irritability and emotional changes, fatigue, and lack of concentration. For the purposes, let's stay in the low-impact arena. It is common for most auto accident clients to make these complaints. Some are transient and some stick around. So the TBI diagnosis should be made immediately and monitored over time to see if it will improve or be permanent. It depends on many factors. Future care at MMI will be difficult as curative phase can last for years in TBI. Now let's look at soft cervical injury trauma that leads to the #1 cause of chronic symptoms, ligament injury. The upper cervical spine atlas and occiput are held together by ligaments. There's no discs in the region, and it has the most concentration of cranial nerves, including the vagus nerve that controls many parts of the body. When this area is injured, the instability can trigger a cascade of symptoms that mimic and add to TBI symptoms. Symptoms from the cervical trauma are added to TBI as vertigo, dizziness, irregularity of breathing, numbness radiculopathy, weakness, headaches, migraines, and more. Think about your most condensed area of nerves that give life to who you are suddenly injured, and there's a bone moving quickly over the area. Inflammation, irritation, and it throws the feedback loop off to the brain. It's like your computer is suddenly dropped and starts dysfunctioning as the circuits are injured. The upper cervical joint motion in combination with TBI are why your clients are suffering long-term if not diagnosed properly. You can't win them awards if you don't know it's there. It's not quantified, and if there's no biomarkers to prove it. This is pretty significant. And yet, most of those never make it into the doctor's report. Now, why is that? Because the providers aren't trained to identify them together, and that's where the case's value is leaking away. Here's what a trained chiropractic physician should do. Do a full symptom history, each diagnosis, and proper motion x-rays to get the ligamentous damage established. do the objective testings for TBI and refer out, send the PTSD out to the counselors, and then do the full care and document well. I've seen a lot of documentation that was missing well over 57% of significant diagnosis and quantitative biomarkers that leave you on the legal side trying to overcome it with legal magic, or worse, trying to nudge that doctor. I recommend when you have a low-impact auto soft tissue injury, you first triage them to a solid chiropractic physician trained in personal injury care and documentation that should quarterback the case for you. Michael Coates, JD, recommends this as well in his Personal Injury Made Easy. They should know how to assess the ligament injury, start a TBI referral, and assess PTSD. Then provide the proper care and referrals out and document it all for you in a nice narrative report. Thanks for your time, and reach out if you have any questions.